Welcome to this Zoom, which is another Zoom organised by Q's Quality Management in Healthcare SIG. It's great to see so many people registered. I think we had almost 100 registered for this in the end, and we've got more than half the people here, which is a great turnout. What we're going to be doing today, we've got two main people, Tom Rose and Jem Ramazanoglu. And they'll be kind of in discussion about Jem's 10 years, I think it is, his 10-year journey towards creating a quality management system. So we'll hear, how far he's got. Just very quickly, so Tom is a research fellow at the Institute of Applied Health Research in Birmingham, and Jem is a quality improvement program manager at Central London Community Healthcare NHS Trust. But they might say a bit more about their background when I hand over to them. The structure for today is Tom's going to do a very brief intro to his own background. Then we're going to have Jem talking about that journey, giving a brief presentation. Then Tom will be responding to Jem's sort of situation and his journey. And then after that, we'll get to a kind of Q&A. So if you've got questions, do put them in the chat, and you can put up your hands as well. But that will be sort of later on in the session. And briefly near the end, we're going to hear a little bit from my Q colleague Spela about some of the Q community's work, because there's various sort of projects and things going on around QMS that Q's involved in. So we'll just for a few minutes hear that near the end. So I hope that all makes sense. So the first thing is to hand over to Tom for a brief intro.
Hello. I've been working in quality management in the companies that I've worked for over 40 years. In the 1980s, when BS 5750 first came out as a quality management standard. I've also been a member of the Chartered Quality Institute for the same length of time, and I was their deputy chief examiner for a period, and wrote a lot of the examination questions for particular parts of the quality management training module. I since retiring about 10 years ago, I've been working with the Q community to try and bring my experience in quality management into the NHS. I think that's
Thanks, Tom.
Yeah. Oh, yeah. I forgot to say, yeah, I'm also a research fellow at the University of Birmingham, researching process management in the NHS.
Thanks, Tom. Shall we hand over to Jem to share a very condensed version of his 10-year quality management system journey? Jem.
Thank you, Matthew. So I'm going to attempt to share my screen. So I'm not that familiar with Zoom. Hopefully it will work as intended. Looking good. Fantastic. So I will thanks for coming today to listen to our talk. I'm Jem, so I'm the quality improvement lead at Central London Community Healthcare, CLCH. I've been here a very long time, and as Matthew said, we've been talking about quality improvement for a really large part of that time. Only in the last couple of years talking quality management, and I guess I'm just going to give you a really brief history of why and how we've ended up here today, and why it's important to try and understand what quality management is and to be able to explain it to others, because I think that's really the point about today. There's a lot of confusion out there about what quality management is, and if we're going to use it helpfully, we need to try and create that clarity. So that's kind of the purpose for us today. So I'll start with this very helpful picture that was published by the Health Foundation probably about 7 years ago now. I think it was quite a while back, but it was a brilliant summary of the journey that you would need to go through to embed continuous improvement in an organization. And I, like many others in the world of quality improvement, had started off by learning there's this great thing called quality improvement. We should all be doing it. And in order to do that, all we need to do is just train some people, and diligently started running training programs. So as the journey suggests, starting at step 4, and having spoken to many of my peers over the years, that's not an uncommon mistake to make. And like many others, you find that that really doesn't work very well, because what you've got is people being trained up in methodology, using tools, then getting really enthused that these tools are great and it makes a lot of sense, but then going back into a system that doesn't have any use for it, or even worse, as some of the people would be told, that's not your job. So just get on with your job. So we went on a short version. We went on a very long journey to try and understand how we could be doing this differently. And back in 2016, started to think about it in a more strategic way. Over the next couple of years, started to work with our leadership team to say, actually, how would you lead differently? In 2018, we had the board go on our the NHSI board development program that was being tested, and we were very fortunate to have Anna and others come and provide some support and training for the board, and that helped us to get to that stage where we actually started at step 1 and really started to understand where are we as an organisation. We got the board on board. I got funded just in 2019 to bring in some quality improvement resource, and obviously hit COVID, which didn't help. But we're really at that point, we started to rethink where are we and how are we trying to adopt and embed improvement into what we do on a daily basis. And starting to move through the process, we're probably now getting to around step 5, where we're starting to think, how do we align this into what we do? And I think one of the big challenges for me is the quality improvement is often just not part of how we work. It's a nice to do. It's a thing that you have over here, where how you operate and manage your organization sits separately. And I seem to spend a lot of my time trying to convince people that it's a good idea to do quality improvement rather than it being a requirement of how they operate. And I think that really is where we got interested in the role of the quality management system, which more explicitly articulates the place and the role of a quality improvement approach within an organizational management system. And rather helpfully, the NHS Continuous Improvement Delivery Review, as many of you will be familiar, started probably a couple of years ago now, and many of us on the call, I'm sure, will have been part of that process. But what was really interesting for me is this was one of the first times I saw something nationally coming out that said embedding a quality management system is something you should be doing. Now, you'll note that this is not the latest version of NHS Impact. In fact, the wording changed from what was originally started, and it's now embedding improvement into your management systems. But I think the reason I'm showing this slide, this is an old version, but this was shared at one of the IDN meetings, and this got me really interested in what's this quality management thing. And at that point, I realised that I needed to learn more, because I will say with hand on heart, I am no expert in quality management, but started to get very interested in it as a result of that. So we needed to learn about quality management. What is it? How does it work? What does it actually? What's the function of quality management? And how do you do it? So the first thing we did was we got some help, and I'm very glad to see Peter Dudgeon's on the call, because he was our guru at the time, helping guide us through our quality management journey. And I would say it's absolutely essential to get some really good support to guide you through this journey, to try and make sense of it and understand how that works for your organization. So we then started to look out and try and understand what is out there. And a few years back, ISO 9001 was the kind of the gold standard for quality management that we go and look for. And Jit, I can see you're on the call as well. Very helpfully was helping us to understand how you can use ISO 9001 and adopting that into an organizational approach. really complicated and very technical, and really hard to translate that into terms and language and concepts that people could easily understand if this is not something that they're familiar with. Many of you will be aware of the QMS webinar series that the Health Foundation developed, and I'm sure we can get a link into the chat there if needed for those who haven't seen it. A whole series of webinars talking about quality management systems with a great range of speakers and experts from different industries and many NHS organisations talking about their quality management experience. But one of the big challenges for us with that was it was confusing. There was loads of brilliant information and knowledge, but lots of new language and lots of concepts which didn't all seem to make complete coherent sense. And that really led us to, in the quality improvement networks that I was in, start to have conversations with each other about, well, what is this QMS thing? How does it actually work? And whilst the webinars were brilliant, we didn't really have space for that conversation to just talk about it with each other and try and understand it. So that's what led Emma and I, Emma from Kingston Hospitals University Trust, to develop and kind of co-found the QMS Implementation Leads Network, which is essentially just a community of practice where it was a bunch of people who have either experience or responsibility or interest in quality management coming together to talk about what is this QMS stuff, how are you doing it, what can we learn from each other, and what can we share. And that's been really instrumental, and I can see many people on the call who have been part of that network. So welcome to all of you today, and please do contribute your thoughts later. And we also then started to test quality management. So first test, Pete very helpfully guided my team through our first QMS journey. So within the quality improvement team at CLCH, we started implementing a quality management system. And that was really where I started to understand a little bit more about what a quality management system actually was, how it worked, how do you actually start to put the bits in place, and what does it take to actually run a quality management system. And then we've also, you can see on the screen, one of our clinical boards started a pilot with one of our clinical areas to say how can we take the learning from what we've done in the quality improvement team and try and translate that into a clinical ward and see how we can help them to adapt and incorporate that learning. So all of that has been incredibly helpful for me and my organisation to help us understand a little bit more about quality management. But for those who've had that learning, it's fine. But how do you actually explain it to somebody else? We use these terms: quality planning, quality improvement, quality control. You'll see that a lot in the NHS discussions around QMS. But if you go to industry, those terms aren't so frequently applied. What is a QMS? And if you were trying to explain it to someone, how can you explain it in a way that helps them understand what it is, what it isn't, and what would it even involve? And so I came up with this. So I think this is what I wanted to spend a little bit of time talking about. This was my interpretation, and Pete, I appreciate a little bit of help because you gave us quite a bit of helpful feedback about what this could or couldn't be. But this was my very inexpert attempt to describe what quality management contained and what was inside it. So I'm just going to very briefly walk around it, and then I'm going to hand over to Tom to kind of give a bit of feedback and kind of help us understand what's good and what's not good about this. So I think that the 4 key areas, there's something about having clear plans for how you deliver strategy for your organization, a clear vision of the future and a clear way of how do you move from where you are to the future. A really important part of quality management is understanding the needs of the people that you're serving. And how do you make sure that you've understood those needs, that the way you work is designed to meet those needs in an efficient and effective way, and a system to actually check that you are working to those standards. And when anything isn't working, a system to then trigger improvement. So that's the kind of the key concepts that I've taken away from quality management systems to try and translate that into what that means to me. So we'd start by saying, at the top of the circle, where are we trying to get to? Have a catchball conversation, which is kind of an up and down organizational discussion from the top to the bottom and back up again to discuss what are the priorities, what are all the different needs at all the different levels. How do you then coalesce that into a small set of important things that we need to deliver in the next 12 months? Translate that into a local plan, which hopefully has a resource plan associated with it. And then everyone's got a clear plan for what they need to do in terms of the change work over the coming year to deliver on our strategic objectives. You then need a place to track and monitor this. And we found that a lot when we started to do our planning work. We'd forgotten to create a forum to actually check that we were doing it. And there isn't a natural forum necessarily that exists to do that. And it's really easy for this stuff to slip. So that was one of our key bits of learning, was you need to make sure you're monitoring your plans and that you're actually checking you're doing the things you said you were going to do. The next bit, which felt really new to me, coming from the world of quality improvement, was this bit about capturing requirements. It's very familiar for people who've done like Lean Six Sigma, that kind of voice of the customer kind of work, where you're saying, well, what are the requirements? How do we translate that into a measurable, specific requirement? But it just feels like something we should do more of, but we aren't necessarily doing this routinely, is my experience. But that's really the start point. How do you make sure you really understand what your service is there to deliver? Who are all the different stakeholders? What are their priorities? And you can't meet everyone's needs, but who are the most important needs? And how do you know if you're meeting them? So that can be obviously stakeholder needs, but also you'll have your policy requirements, regulatory requirements. You need to know that you're delivering these, but how do you measure it? So that's where you need to set some metrics, some performance indicators, and potentially critical to quality. So that's what the CTQs stands for. That's, if you say have a process that's intended to deliver a particular outcome, what are the key steps in that process that are really critical to ensuring that you get that outcome? You don't want to necessarily measure every single thing you do, but if there are one or two things that you're going to measure, what would they be? That's your critical to qualities. So then, having set your frame for what it is you need to design, then you need to build and design processes to deliver those outcomes in an efficient and effective way. And I don't know about the rest of you, but my experience of designing processes in the NHS is we tend to build the plane whilst in the air. We're often iterating and evolving as opposed to designing specifically how we should be operating. So that can be really challenging in my experience, but it's a really important step and something that feels familiar for us in quality improvement world, where we're looking at processes and thinking about how could we be doing things better. The monitoring and review process is to make sure you're checking in on those things, to make sure that you know who owns a process, know that they need to be reviewed and updated and checked. And it's just having a good governance process around that. Then that sets us standards for how we should be working. That defines what quality is. How do you make sure that you know how to deliver quality to a high standard, and that's translated into operating instructions, whether that be a process defining the tasks that need to be performed in a specific order by specific people, or the SOPs, or sometimes it's called standard work, which are the how-to instructions or how to do any one of those tasks in that process, to make sure people have really detailed and specific instructions to follow. And that's really been challenging, because what we find is a lot of the information on how to do your job it's not written down. Often it's very high level. It might be in training packages, it might be in a policy document, but it's not always available to people. So creating those documents is actually quite a challenge for us, but a really critical part of a quality management system, because without that definition, how do you know if you're working to that standard or not? So that's the most important part, is to then have self-monitoring by teams. And I think the way we've typically done this in the past is for having like a central governance or assurance team that would go out and do auditing, or require teams to go and do auditing once a year to check on standards. But actually, QMS is more about team level continuous monitoring of quality standards to check that you're actually working to this standard, and to identify if you're not, that you're not, and you need to do something about it. So you've got what's called a non-compliance resolution process. So if my team are expected to work in a particular way, we should be checking that we're working to that standard. We should be flagging if we're not working to that standard, and we should be then doing something about it. So again, having a system and a process in place to enable you to actually do that is critical. And I think that's probably what Tom will be talking more about, is the management system that you need to make all this work. But lastly, so in this part of process management, it's about saying, well, when things aren't working. So let's say we've set KPIs for the things we need to deliver, or critical qualities to check our standards. What we need to say is that actually, if we're not following standards and we're struggling to, and we continuously aren't following standards, we need to ask ourselves why. If this isn't a simple thing to fix, there might be something really important that we need to understand about the challenges and constraints. And that might trigger us to look at this as an improvement project, where we need to take a step back, do a bit more thinking, a bit more understanding of the problem, and to try and start to find out how to make it easier to comply with those standards. Or the other side is we might be working to those standards, but actually find that it's not delivering the result that we were intending. In which case we might need to stop, take a step back, and actually say, are we actually working in the best possible way, or is there maybe a better way that we could be working to deliver those outcomes? And either of those should be a trigger for some improvement work.
Just to say, do move along, because we need to hand over to Tom soon. We're kind of
I've got 1 minute left, and then I'll try not to talk too much. Apologies. So at this point, you're really in the space of improvement now, starting to say, well, actually, you need a forum to identify, to have the conversation, really, to say, well, where is it that how are we doing? What are the things we should be trying to improve? Which one of those do we want to prioritize? Who's going to do the tasks? How are we going to allocate that work? How are we going to monitor it? And most importantly, apart from the voice of the data, as it were, of the management system, you need to hear the staff voice, the people doing the job, understanding their lived experience, what's working for them, what's challenging for them. They need to be able to flag the need to improve. And equally, the voice of your customers or patients also need to be able to flag the need to improve. And whilst you're doing that improvement work, if it's not working, you need to be able to escalate and to say, actually, we can't fix this problem. This needs to go up for support and resolution. And so that helps us go back to the next year and say, actually, if we're continually trying to improve but unable to improve, maybe we need to tackle this in a more strategic way. And that can help us then link improvement priorities to improvement efforts, and most importantly, the learning that we get from improvement work back into the design of our working processes. So that's my attempt to summarize a quality management system. Thomas, I know you've had a good chance to read through this. I would really appreciate your feedback on what you think you like and what could be better, if that's helpful. And also just let me know if it's helpful to leave this up, or whether it'd be better to take it down.
I think you need to take it down, otherwise I probably won't be able to share my screen.
Done. I'll try and put a copy in the chat for people so you can refer back to it.
Okay. When I first saw Jem's diagram, I thought it looks good. And I do agree with everything he said and the way he's described the journey around that diagram. I like the way that the arrows are pointing. My idea of quality management has come from the traditional quality management system style that most people in the universe really are using, and that stems from in terms of healthcare, that stems from ISO 9000, and for healthcare it's 7101. So what I did, I had a look at GEM's diagram, and then I had a look at the quality standard, and I'm just going to leap to my diagram that sort of replicates GEM's diagram in terms of the British standard, the international standard, and relating to GEM's diagram. All of this information here is available online, and I've put in the chat the URL to get you to it. I won't go into all of it in a lot of detail, but just have a look at this diagram. Wrong one. Done it again. Sorry. Oh dear, sorry. I'm off to a good start. This is the one I should be on. Now have a look at this diagram and compare it in your mind's eye with GEM's diagram, and you'll see that these boxes replicate what GEM has in his diagram, which is really good. I was really pleased that, having not seen this standard, GEM's created his diagram, and the two diagrams could sit on top of each other almost. There is a big difference though. This diagram is constructed around a management system. The management system takes what's happened up here, feeds all the way around to create your services, identifies a management system for monitoring the delivery of those services, and then feeds back into the top again. So that's what a management system is all about. And it's the management system really that I want to talk about, but also comparing what ISO 7101 looks like in comparison with GEM's diagram. And as I said, I'm really pleased that the two could be laid on top of each other. So going back to my slides, I'm not going to go into all of this because you can have a look yourselves. There's a little bit of spiel about me. There's what I'm doing at the university, and you can have a look at that whenever you want. But what I wanted to talk about was management systems, and you'll see at the beginning, I've lost it there. Annex SL. This is the International Standards Organization of what a management system should look like. And all international standards that include a management system will use this same management system. What I think you need to do is separate quality management from the management system. This is the management system. And all international standards now that have a management system will follow these 10 clauses. And this management system has evolved since the old BS 5750 days. BS 5750 was the forerunner to ISO 9001. And as a lot of people keep saying, it did come from manufacturing. Originally, BS 5750 was written for manufacturing. But since then, the same management system has been used across all sorts of industries. And if you want to find out a little bit more about it, if you Google Annex or go to Wikipedia and search on Annex SL, it will tell you a lot about the standards that are using this management system. It goes across all businesses and all services, and all different organizations are using this management system. The diagram that I was going to show you, that I kept slipping up and showing you, this is a bit of a torment, I know, here, looks at some of the standards that are used in healthcare. And several of those use this same management system. So the management system is already being used in the NHS, in places like pharmacy, labs, and radiography. Radiology, is it radiology or radiography? I don't know. Anyway, those standards will be using that same management standard eventually. some of them won't be implementing the new management standard until they get updated. But nevertheless, that same management system is going to be used across all of the ISO standards that require a management system. One of the differences between QI and continuous improvement is that continuous improvement is associated with improving your processes. Quality improvement is interested in improving quality. I think Sophia posted a thing in the chat earlier saying that it's difficult to define what quality actually is. Well, in sort of quality management circles, quality is defined by you say what you do and you do what you say. If you can meet two of those aims, then you will probably be delivering quality. The most important bit to me is the say what you do. And you've got to say what you do in terms of the processes that you use to deliver your services. There's a lot of confusion as to what a process documentation set should look like. You've actually got to document your processes, otherwise you can't say what you do. What you don't need to do is document all of the tasks that you've been taught in your training. No one wants to know in your process diagram or your process documentation how to take blood or how to undertake a diagnosis, because you've been trained in order in that. So there is a big difference between process documentation in terms of the requirements of a quality management system and process documentation as you might be used to in the past of some of the SOPs that you might have read. There is this big difference. And I think one of the big aims that I've had throughout my 8 years with the Q community is to try and explain to people what a process is in terms of your working day and how you document that process and how you ensure that people are delivering that process as was intended. If you can do that, then you have you're part way to having a quality service. So if you've got any queries on what I've been saying just then pop the questions into the chat and we will have time to have a look at them. But I have spent quite a bit of time here trying to explain what the differences are between a management system and general management. And you'll see from here, where I was talking about myself, you'll see dyslexic there. So I'm fairly dyslexic, which means that my writing skills aren't brilliant. So I use ChatGDP quite a bit. I know some of you might frown on that, but I've used that to produce some of these arguments for a quality management system. Or rather a management system as opposed to general management. I won't go through all of these now because you can just have a look at them in your own time. But I've done quite a lot of questions on ChatGDP, and I think the answers are very, very good. They're almost what I would have written myself if I'd been better at writing. How did a management system evolve? There's all sorts of things here that will explain to you the difference between a management system and management. There is a major difference. And if you do nothing else, then have a look at that Annex SL so that you can get a better understanding of what a management system is as opposed to a quality management system. The management system takes you from the start of Jem's diagram right round in a big circle back to the start again. Exactly the same as was shown in my diagram of the ISO 7101 standard. So I'm not going to go very much more into what I've said here. You can have a look at all of the documentation that I've put here. One thing I have included is a talk from the recent Q Community, what was it called? Quality First or something. Live. Yeah, that's it. Quality Live. I've got a recording of a chat here, which you can have a listen to in your own time if you haven't already heard it, where Penny and one or two other people are talking about quality management systems, but they don't actually talk about BS ISO 7101, unfortunately. It would have been great if they had actually mentioned that. Okay, well, I'm going to shut this down now, and we can then go to a discussion between Gemini, where Gemini, that's a program, isn't it? Or is it a group? Gemini. Sorry, I'm getting trying to be funny. I'm obviously not. Where I'll speak to Gem in some of the comparisons between the diagram that I've produced and the work that he's doing, and I want to ask him some questions about how he has done certain tasks that are required by ISO 9000 and ISO 7101. How he sort of accomplished those tasks using his own ideas. Is that fair enough? I'll just stop sharing my screen then. If you have any questions on this, then you can contact me here. You can send me an email, or you can contact me through the Q community fairly easily. Lots of people do, so I'm quite used to that, and I'm happy for that to happen. Right, back to Gemini. I still think that's funny. Right, Gem.
Go far away.
How do you feel about the fact that the diagram that I know you've seen my diagram or previously. How do you feel that the two ended up being very similar?
Relieved. I would say. I think it's been really hard getting my head around QMS. I think it's one of those things. I think Pete, you described it really helpfully, saying a lot of the stuff that IHI have been talking about for decades had almost been on the assumption that you've got a QMS in place, and it just made so much sense around why quality improvement was so difficult in the NHS. It's because if you don't have a QMS in place, you aren't starting from a point of stability, of having like a standard that you're working to, and then understanding is it that you're not working to the standard or that you need to improve it. So it's really been important for me to get my head around it and to get the feedback that the way we're trying to articulate it is close to how yourself as an expert would describe it is very appreciated. I think I would say, just feedback, I've really struggled to follow your diagram. I kind of trying to work my way around it, but I'm getting stuck on, I can't find number 3.
Yeah.
Yeah. But I love it. I love the detail.
I missed out clauses 1, 2, and 3 because, but you will find them in Annex SL.
Yeah,
they're more sort of high level things where the board sits down and defines what it is you do. I mean, that's already, a lot of that has clearly already been done. Otherwise, you wouldn't be doing anything. But and it wasn't worth that. They weren't necessary to produce that diagram, I didn't think.
Yeah.
Yeah.
It was like I said, to answer the question, it was really relieving and helpful.
Yeah,
to know that the way we're trying, I'm trying to understand it has been a kind of a good enough way of describing it.
Yeah.
The challenge for me is the language. That is the hardest bit. It's new concepts. We're trying to get people to rethink about things which they're very entrenched in the way that we've been doing things within the NHS for a really long time, and trying to get people to reimagine some of this stuff is quite hard. So getting the language right, I think, is crucial. I think we were at the Improvement Cymru event last week, which, if you didn't see the recording, folks, go and see it. It was fantastic. I think the way they described it was so helpful, and I think the one thing I've really taken away is one of the quotes was, "Quality is not a directorate; it is an approach," and I think that is really important if you think, how do we translate QMS into the NHS? Because we've got a way of working where quality is someone's remit, and that they own the approach to quality. But if that is how we approach quality from a QMS perspective, it will not work. So QMS has to be quality in all aspects of our work. So it's all our work, not just one bit, one kind of siloed approach. Does that make sense?
Yeah. Well, I wanted to pick up on something else you said. You said that usually it's like building an aircraft when the aircraft's already in the air.
That's how it feels.
Well, there's nothing wrong with that, really, as long as you do it very, very quickly, which I don't think the NHS does do particularly well. I just want to go back to my slides for a minute to show a slide that I wanted to talk about. I've done a little bit of a project plan for implementing a quality management system. If I can find it, I don't even know my own way round here. This is looked at from the clauses of my diagram. So I've split it into 3 parts, where clauses 1 to 5. I know I haven't got 1, 2, and 3 in that in my diagram, but you can have a look at what 1, 2, and 3 are in the Annex SL, which I put a link in for. So clauses 1 to 5 are really at trust and board level. They're the people that have got to comply with those clauses and produce the documentation around those clauses. And then you've got part 2, which all the other staff, less frontline staff and QI teams. And they have sort of responsibility for clauses 6 to 7.4, and then clauses 7.5 to 10 would be addressed by frontline staff and QI teams. Now, all of these 3 parts can run concurrently. Part 3 is most definitely the most difficult, but I'm not saying it won't be difficult for boards and the leadership to understand what those first 5 clauses are. It's all going to be very difficult, but what you can do is sort of reverse engineer. Because you're already delivering services, you can define this work as done. Work as done. It's really important that you look at work as done. I'm sure I've mentioned it previously. When you're documenting your processes, it's got to be work as done, and then you build backwards and build down, so that eventually the part 2 elements of the quality management system, the part 1 and the part 3 join together in part 2. So it is a little bit of a reverse engineering thing. You are already flying the plane, but if you want to deliver quality management, you've got to start documenting your processes and then ensuring that your processes meet the requirements that have been set upon you by the board and your leadership.
Tom, do you think we could move? We're a little bit behind for getting to having any time for questions. Can we move?
Yeah, I'll finish right now.
Is that right? Yeah, I saw there were some in the chat. I think the first one that I saw was from Kedar. I don't know if you want to come off mute if you're.
Yeah. Hello.
Oh, actually, you're still on.
I'm Kedar. Yeah.
Oh, is that? I can see a Kedar on mute. Are there 2 Kedars?
So which Kedar are you asking for?
Oh gosh, which
I
one
am
was
from
it?
India.
Yes, it must have been you. Go for it.
What I put the question was, how can we account for the adaptive or behavioral challenges in the quality management system? As we always say that quality is always affected by the adaptive and behavioral challenges. So where in this diagram can we account for tools at what level or at every level?
Jem, do you want to
So I
where
didn't
on
I
your
didn't catch the
diagram?
whole question, Gil. Would you be able to put that in the chat? Because I heard something about how can we adapt for the tools. I didn't hear the whole question. Sorry.
I think the question
I'll
was how do we
repeat it.
account for adaptive behaviour and behaviours more generally within the quality management system. I think for me, this question is at the tension between where do you define a standard and expect behaviours within that, and where do you expect people to operate on the sort of instinct, hunch, reaction to gestures made by other people, what the relationship between two is. That's how I read the question anyway. I don't know if you want to, if you think I've clarified that well or not.
Absolutely, that's what I intend to ask.
It's a great question. I guess that's something beyond my knowledge and expertise. I mean, I can chuck my tuppence in and say what I think, which is it's really important to define quality standards for the things that matter. I think the experience of going through a QMS journey it's a long journey. We've still got, we're 2 years in the QIT, we've still not written half of the standards down. There's just so much work to do to document everything. So I think there is always going to be, until you've got a fully built system, there's always a need to adapt to the changing conditions around you and to be able to be slightly flexible and reactive to that. I think once it is fully embedded, I think for me it goes back to that there's more than one voice in the improvement system and that improvement component, which is you need the voice of your management system telling you, are you working to the standards? Do they appear to be working? But you still need to hear the voice of the customer, as it were, or our patients, and you need to hear the voice of the staff. They all need to be able to identify things that could be better and to be able to trigger improvement. So I think that the management system only is ever going to be one voice out of that system. That's my tuppence worth.
I've got Tom, I've got another question for you.
Well, I was going to answer that other one first.
Okay, well, be really quick because we've only got 4 more minutes for questions.
Okay, well, there's loads of standards out there. There's NICE, there's WHO, there's NHS England standards. There's lots of standards. There's the Get It Right First Time standards, and there are a lot of standards. But it's up to you to identify the standard that you want. And don't forget that there are the 5 or 6 quality markers that were in the centre of my diagram that the NHS have published as a quality standard. Okay.
Thanks, Tom. I've got another question for you. This is from Rochelle. Is there a particular methodology you use for designing for quality? I don't know. I mean, either of you can jump in, but is there a particular methodology you use for designing for quality?
Yeah, yes, definitely. It's just design. You have got to you can't design for quality unless you're trying to work towards a standard. You've got to have a definition of what it is you're trying to deliver at the beginning, and then you design your processes to meet that requirement. And the standards are in NICE are pretty well clear. I suppose you could start saying, well, every patient that comes in for treatment, we've got to have a satisfactory conclusion for 50%. That would be a standard, wouldn't it? But that's not the sort of standard that you can even consider setting in healthcare, because every single patient is different. But what you can do is say this is the standard of how we treat them, and how we treat them medically, and how we treat them as an individual.
Thanks, Tom. I don't know. Pete had his hand up. We sort of maybe got time for one more.
Yeah, just
question. We might be able to answer questions later on in the group space as well, which we've done before. But did you have a question?
Just coming in on two of those questions. One about adaptive behaviours. What I tend to find is there's an awful lot of noise in health systems that are often characterised by us saying we need to have adaptive behaviours to deal with those complexities. When you actually look into them, a lot of them are more like complications that come about of poorly designed standards. So I found as standards improve, it allows you to adapt in those more truly adaptive spaces that exist. And it's a big topic, can't get into all of it, but that's my key thoughts on that. And on the second one, into translating design needs or needs into design, there are different schools of thought, like quality function deployment, and even just use of simple documents like SIPOC documents can help you, depending on the level of complexity of the process, to understand needs and then go about translating those into critical to quality elements that inform the standards. So just a couple of tools out there, but there are others like Kano analysis and a few others.
Yeah, I'd like to add that as well, that design should be done by designers, not frontline staff. Frontline staff can improve, but you do need designers to set your initial designs.
Thanks, Tom. Thanks, Pete. That's great. Sorry, there's not been that much time for questions, but we, if you put them in the chat, we will, I think, hopefully try to answer some of them in the group space. We were going to go over now to my Q community colleague Speller, just to say a little bit, because there are various QMS things that Q's involved in at the moment. So I know there was a slide we were going to share, and Speller will just tell you a little bit about what's been going on and what's going on at the moment. Maria, were you going to share that slide? Just coming.
Wonderful. Just really quickly, I think, Jem, particularly, thank you. You've done a lot of my job of just bringing attention to a few of the things that Q has been doing in the QMS space. So this is just a really brief kind of list of some of the activities we have on the way. I think perhaps most interesting, and also people might not be aware of that, even if you follow Q closely, a project that we have on the way to gather insight around QMS. And we commissioned a group of researchers who are at the moment speaking with different organizations up and down the country, UK and Ireland, from those who are quite early in the QMS journey to those who are more mature, as well as national leaders involved in this work. And we're particularly looking at examples where QMS is being embedded at an organizational level. So not just different departments, but like what have been the different approaches there? What can we learn from people who are doing this, who have been doing this work now for some years? We plan to have outputs to share later in the year. But if this piques anyone interest and would want to be involved in any ways before then, that's my email on the slide. We'll also be sharing the slide and all the links with you after this call, so do get in touch. The other things have mostly been mentioned. There's active special interest groups with Q. I've already posted a link to a QMS visit in Wales that we held just last week. That there's a really useful recording, about an hour and a half, edited down, Wales sharing some of their journeys and what they've learned through the work that they've been doing, as well as previous webinar series. And just to flag that later this week, we also kind of the back of the webinar series that we held, some a couple of years ago, some more recent. We pulled together some of the key resources and tools, and we'll be sharing that quite soon. So watch this space. I think I'll wrap out here. I see we're nearly to time, and we'll share all of that, as I said, in the follow-up email.
Thanks, Speller. Yeah, we're almost to time, so I really just want to really thank Tom and Jem for making such great sense of such a complicated topic that so many of us are on the journey towards quality management systems or improving them. And thanks for our guru Pete, who turned up as a participant, who was able to chip in as well. That was really fortuitous. If there's anything you'd like to see in future from Tom's special interest group on quality management in healthcare, maybe put that in the chat. Be great to hear about other things that would be good for us to focus on. And I think I see that Tom has volunteered him and Jem to sort of answer any of the questions we haven't really managed to answer yet. I think there may be some more in the chat we didn't get to, and but do add anything in the chat that you'd really like answered, and we'll put that in the group space. But yeah, thanks so much, Tom and Jem. Great diagrams, great clarity, and thank you.